We're live.
All right.
Live?
You guys are live.
Perfect. What is up, beautiful people? And welcome to What's Up Wednesdays with the professionals of the roundtable. Today we are joined by Dr. Danny. Hi, Dr. Danny.
Hello.
Awesome. Tell us a little bit about yourself.
Good evening, everybody. This is gonna be my first time ever to present this. My name is Dr. Danny Coyne. I'm the practitioner of Oriental Medicine in the state of Pennsylvania, and that's who I am.
Awesome. So, how did you get to where you are today? Like, at what point in your life did you decide this is what I want to do?
Well, when I was in a state, when I was 13 years old, I always have a vision. The vision is to become a doctor, specifically a pathologist, a scientist, and a pilot. But as the year went by, I went through, the passion was that when I graduated as a pre-med, I found a scientific job where I started as a junior scientist. And within a couple of years, I found out about acupuncture. And my goal was to try and get into medical school, was looking at PCOM originally. And but when I found out about acupuncture, I read about it. I fell in love. There was I left Pennsylvania, went straight to Texas for my master's degree there. Within 4.5 years, I finished. Started practicing in 2002. So from then on, Pennselsvania, I always trying to be. I still work as a scientist, side by side, within molecular genetics, biochemistry.
So, how did you get to where you are today? Like, at what point in your life did you decide this is what I want to do?
Well, but I never left in a state when I was 13 years old. I always have acupuncture, always side by side. The vision practicing is to side by side for quite some time, at least 23 years. Specifically, so I went and got my a scientist and a pilot degree. But as the year went by, I went through from the passion was that Texas when I graduated as a pre-med university, found a scientific job. Well, it's initially started as a junior scientist, and within a couple of years, I found out about acupuncture in Minnesota. My goal was to try and get into medical school. I finished that and originally. Ever since I've been practicing and
became a master of
but
your
when I
craft.
found out about acupuncture, 2022 March 16th, I read about it. I fell in love. There was I so left this Pennsylvania, went straight to Texas just for my the passion of acupuncture and Oriental medicine. Within
And how did that passion kind of
four
lead
and a half
you and
years,
guide
I
you into
finished,
creating, healing your way?
yeah. So me and my wife, we were talking about how from then on, Pennsylvania, I always trying to be. I still work as a scientist. At one point, by side, we established 20 molecular genetics, biochemistry 12.
So, how did you get to where you are today? Like, at what point in your life did you decide this is what I want to do?
Well, so I was in a state when I was 13 years old. I love it so much because the point is somehow this medicine I've been practicing my direction by side for quite some time, at least 20 patients specifically. So I went and got my a scientist and a pilot degree. But as the year went by, Oriental medicine a patient. The passion was that Texas when I graduated as a science university, the passion is there. When you see great results scientific job, well, it initially started as a junior scientist. My clinic and within a couple of years, and that's what drives me Minnesota. Into this. My goal was
Makes
to
the heart happy.
try and get
What kind of benefits does acupuncture like
ever since I've been
actually
practicing.
offer?
And so
Became a master of
variety
your craft.
of
So
we say acupuncture 2022 treating with acupuncture help control the central nervous system. Central nervous system is an important factor of the nerve itself. It could be trigeminal nerve, vagus nerve.
And how did that passion
calm
kind of
or
lead
mind
you
in the
and
body,
guide you into
but
creating
indirectly
healing
when
your
you
way?
treat on that direction, me and my wife, patient can be so alleviate from pain. From then on, to Pennsylvania, I always trying to be majority of the time any type of a condition at one point in time. I've done it all. Like pain management, 12.
So how did you get to where you are today? Like at what point in your life did you decide this is what I want to do?
Well, emotional anxiety in a state when I was 13 years old. I love it so much. Majority of the time, the point coming in for pain somehow, this medicine, vision practicing subcategories become quite some time, at least 20 pages. So I went and got my scientist pilot.
Do you have any advice for people who come in that are scared of needles?
So usually, when I would, I usually ask, have you had any treatment, something like how much of a phobia of a needle are you? I had treated someone who walked into my clinics, just only the pressure point, he's already screaming. From pressure point, this gentleman, he usually get a flu shot. Every time he get a flu shot, he'll walk out. He said he's okay. He'll pass out immediately. So I got that gentleman from a simple pressure point to
I feel like that really is something that sets you apart. I mean, in your industry and especially in the common, run-of-the-mill doctor office where everybody gets antibiotics and everybody gets a Band-Aid and a flu shot. Yeah. That's something you should definitely really be proud of that.
both my parents are in holistic health medicine. It's more, my father was in Oriental medicine, folklore medicine. He seeing patient back at home in Cambodia as a folklore medicine man. So he focusing on children and fracture related condition. At the same time, my mother was a midwife, and she's not only helping just delivering babies, but also working on infertility, gut issue, and also she does traditional PT. So I was able to integrate of their knowledge into my practice as well. That set me aside different from many acupuncturists. So I feel that understanding from a scientific way of explaining or understanding what is the disease and the condition, plus with with the inheritance of understanding Oriental medicine from both my parents, seem to help as well.
Yeah, it's definitely shaped who you are as well. It's almost like it's in your blood to help people.
So, yeah, it is. I feel that it's a plus for us. especially for me in this kind of setting. And it's been fortunate enough, we're successful, and thanks to the support of all my patients that are trusting in me to take care of them. So
Yeah. And then you get to pass that down to your kids
yes.
too. We just met with Sahan last week, and I mean he's like your prodigy almost.
So both of the boys, they are in the doctors of physical therapies program. So my goal is to be able to pass some knowledge to them if they want to carry on in that way. But seem like they really passionate about for this kind of helping people, healing people.
Yeah.
So I can see them just like when I was young, where my parents, when they out to treat patients, about they usually call me helping people to go along. So back in the day, I didn't know what really mattered, but you know what, it shaped me into this type of direction. And it seemed like the boys are being like that. Now they in these in the program of Trigger that they just finished training. Now they are starting doing what do you call internship for that. Also, it's kind of, we're happy for them.
Gotta have a proud dad moment, right? Fit it in wherever you can.
Yes, yes.
Are you teaching them kind of in your style as well with the acupuncture and?
Yes, the goal is to be able to teach them to understand. Number one is not just the technique itself, how to understand, how to engage with the patient. You know, you have to have that passion.
Right.
You cannot be healing if you don't have that passion. Seem like these guys have that. So my goal is to teach them what I know and how much they want to know. If I can provide that, standing by. So
I love hearing that. It's awesome. It's just awesome.
Yes.
Just to know that it's something that's going to stay alive and learning from the best, of course.
Also, I having two apprentices. So Monica and Marvin, they are in the trainings. So I will teach them what I had to during the process. But they seem to pick up along the way. So these are the couple acupuncturists that will be joining our Healing Your Ways, and it's a future running down direction.
Maybe we'll get them on a What's Up Wednesday one day, right?
Yes. So definitely one of them will be joining very soon.
Awesome. Well, I'm looking forward to that day.
Yep. Thank you.
What would you say the biggest benefit is? Like, there seems like there's a lot of benefits to, I mean, just first and foremost, going to your practice. I've been in there. The atmosphere itself is healing, but of your holistic method of healing, what do you think the biggest benefit would be in your own words?
So the biggest benefit is for almost every patient walk out, no matter what they do, no matter what they were looking for. So it seemed like I can was able to heal them or to help alleviate, not just from pain management, walk out from the office happily. That sense of satisfaction. It's more like they all say like so relaxing walking out from this clinic. Once they finish the treatment, that's a lot of every one of them saying this is beneficial, super relaxing.
Absolutely. And that's got to be like just a good feeling. Like
it's
right
a good
in your
feeling,
heart,
of course.
having just grown it from the ground up.
Yeah.
Where do you see it going in the next 5 years?
Well, the next 5 years, hopefully the boy will be joining us along, and we have 3 different locations. The third one is in working progress. So I'm hoping to expand a little bit more to introduce some other modality, such as infrared therapy, hot and cold plunge, and what else? Sauna and salt room. integrated into this holistic center, not just acupuncture, oriental medicine. Also, NATE, that's where I'm certified also. It's a naturopath allergy elimination technique. That's the other thing that I do as well.
Yeah, tell us a little bit about that. What is that?
NAET is a technique where you use a test vial that containing essence or the energy of the food that we eat daily. So basically, this involve kinesiology, involve acupuncture, and some chiropractic manipulation. So basically, to desensitize the food that we eat, so we can reintroduce that food again. Basically, not eliminate the allergen, but harmonize the body, so the body accepting that allergen as a food product. As far as I remember, thinking about how food allergens came about, maybe around 15 to 20 years ago, when people started about, oh, it's gluten, that affecting. Yeah. Now seeking gluten-free. From my perspective, I think that is really what we eat while we are talking, we eat while we are sleeping, we eat while we are under stress, we eat while we are having emotional problem. These can create an allergen itself. Your body vibration changes. Based on NATE, it's the energy of the food products that we eat. Imagine if you eat something while you're under stress for 5 times, right? Suddenly one day you just sit down and have that same food. Suddenly you said, oh my God, somehow my stomach is in pain. See, your body vibration change. It's what you eat at that moment, the body doesn't recognize because you're in a relaxation state.
Yeah.
But if you eat like you on the go and under stress, because you did it 5, 6 times already. So now it's your body recognizes, okay, it's not an allergen. That's how I look at treatment, how allergen can be introduced to our body system. Where I advise people to do is eat, just relax. Don't have to have conversation. Eat when you are ready. Don't eat when you want to have conversation. Just when you're ready, go and eat. Have food. Yes. That's how I look at it. And that's to prevent. So NATE, category of desensitize the allergen so you can reintroduce that again.
Yeah.
Me, it's all about harmonize the food. I don't like to eliminate any food or any gluten. How much can you eliminate? So if you think about it, if you eliminate of gluten too much, where can you gluten-free product? What if you mistakenly eat that again in the future? That's going to be a body shocks, right? The more you eliminate stuff, the more you create immune response. Anything that you eliminate, eventually it's going to harm you more than harmonizing it. But based on the allergy elimination, usually you reintroduce the allergen drop by drop. This is a way of introduce to prevent further allergen issue.
Yeah. And then how does the acupuncture work into?
For this, in this NATE. So basically, NATE itself introduced with kinesiology, acupuncture, pressure point, and chiropractic adjustment. So those who can, now I integrate a little bit further, those who want to get acupuncture following the NATE session, that would be perfectly fine. But also, majority of the time I use AccuLaser. We call it Chi Pen or Chi Pulse. That's using a small 635 nanometer current that stimulate on certain point. So it create that affects just like acupuncture point treatment. Somehow with those point, it works as good. So that acupressure point can be used as with that AcuPen or with needle. So it works.
Yeah. Doctor, we got some questions here. What kind of ailment do you guys address?
So a variety of illnesses, anything that you could think of. So we treat this acupuncture and oriental medicine been diagnosis for or treat for any type of illnesses, from pain management, emotional aspect, depression, anxiety, infertility, GI disorder. Majority of the time, people coming in for pain management. So what got me a lot of excitement is that recently it's been successful with a lot of infertility type of success there. So pretty much any type of illnesses, from neuropathies as well, from chemo and radiation treatment where it causes neuropathy, that can be super beneficial on that too. Nausea, insomnia, all this thing. So these are the things that are super beneficial. Yeah, we can treat pretty much anything, but I cannot say I can cure it. Oriental medicine will look at treating the root cause of the problem. It's not looking at the symptom itself. People can come in with knee pain, right? I don't just treat knee pain. So I will go through a questionnaire where exactly that knee pain. The knee pain may just a location, possibly come from the hip itself.
Yeah.
That can cause that. See, the root cause of the issue is where we tackling. If people have migraine, I look at it. Okay, what are the symptoms? What may contribute? Doing questionnaire, I will find out whether it's a tension, headache, migraine, or innate, where people run in a family, or stress headache.
Yeah.
All those things come along with different questionnaire.
Yeah.
So if good doctors of acupuncture or oriental medicine or acupuncturists or practitioner of oriental medicine should be paying attention to how to question and find out where the root cause of that.
Yeah. So this might be a silly question.
Okay.
So humor me.
Yeah.
So let's say somebody comes in with a tension headache versus a stress.
In reality, the
headache.
value is going
Okay.
down.
Would there be
So like it feels like our value has been
Yes.
receding.
So
And
when we look
what
at
is
the
it?
tension headache usually it could be starting from the nape of the neck.
Yeah.
That could be environmental that introduce combination.
Let's
And
say somebody.
when we look
What
at
is
the
it?
tension
The
change differently based on stress headache would be usually start from the back of the neck, shoulder also, but it migrate to the side, to the temporal parietal on the side. And usually, good example, migraine usually have an aura, right? Any all this thing. Stress related headache usually onset on the day that you actually have off from work. Most of the time it start, for instance, if someone walk in into the office and have headache, I would say, asking all those questions, and then they would say, oh, my headache started when I'm, right today when I have off. It gets to where, when, for instance, today is a Sunday, right? The headache soon hit 6 o'clock, the headache start to subside it. This is related to trigeminal nerve issue. We say vasodilation causes, when you under stress, right, it causes vasoconstriction. And when you relax, it causes vasodilation. So the blood vessel overdilated, create that headache. That's temporal parietal headache. Yes.
So does insurance cover acupuncture?
So many insurance cover acupuncture, but I would suggest that if you have question, you can call your insurance company to find out. But more and more now, I see that it does cover a lot of different variety of insurance. But you can call them or you can call us. We can get our billing company to verify that if it's covered or not.
And how many of your patients would you say come in just because they want to see you versus, do they ever need a referral?
So there's certain insurance that need referral, medical necessary. So all these things that they do need.
Yeah.
But majority of the time we treat patient as long within that range of limitation 3 months. If they have not been diagnosed, preferably, so they should seeing a medical doctor to get the real diagnosis and then come to see us. That's where but we can always treat it as long within that time frame. And because everything go by rule and step and all this thing. But overall, yes, there's no referral needed.
So it can go like either or.
Yeah, either or. But once after several months, we have to have medical doctor to check what is the actual. For instance, if they have a severe chronic neck pain, it doesn't get alleviated, so we refer patient back and forth to whomever they need. So
So
we work very close together.
So it says, this person in the chat says, my kids tend to get concussions from sports and doctors. Don't have much to offer. Can acupuncture help concussions in recovery?
Yes. Good example. One of my son, he had a severe concussion from playing basketball. He got tripped when he was around 6 years old, broken 2 of his front teeth. That's a Joshin. So we went through nightmare for few years, but with the combination of my treatment and laser therapies, somehow he out of it. He's doing really great. Yes, acupuncture definitely
and
very
even
beneficial.
just the red light therapy too that you guys do is amazing. When I just had a concussion, what was it, like 2-3 months ago now?
Yeah.
Even after just the first 2 treatments, I had so much pain relieved. It was insane.
Yeah.
You guys definitely do help even with just concussions.
Yes.
It's helpful. I mean, even in just the littlest things that I think most people don't really think to go the holistic route for. Because even I went to the ER for mine. So they said, oh, just go lay in a dark room and don't look at the TV or the computer. My job is working at a computer.
Require all those things. There's so much concussion. You gotta be conscientious about concussion when kids playing sport. So after the third conversation of concussion, that person should be reevaluate whether they can go on or not. So definitely sport depend on what sport.
Absolutely. High contact sports are probably
yes.
So take it
do
easy.
you guys work on sports injuries? I saw on your website you may work with professional athletes.
I work for the Philadelphia Flyers as a contractor for 14 and a half years. Philadelphia Flyer hockey. So yes, I do, and I also used to work for the Jersey Devil for quite some time too, for a couple of years. And I'd be on at the training site Voorhees for so many years. 2010 when I started there, so until 2022, the new group coming in. I've been super busy. Yes, I was able to have that luxury to join that group, kind of as an honor, but at the same time to see the experience show that. So.
This person says, I have a lot of stomach issues and don't have much hope. What can I do?
So usually stomach issue related to stress and anxiety. Stress and anxiety can trigger eventful of stomach. Usually because 6 emotion, based on the Oriental medicine, which is 6 emotion is the leading cause of many internal disease. Number 1 is as soon you have stress and tension, first thing will you experience is like a butterfly in the stomach, like a epigastric center below the rib cage. You feel like tightness, this thing. So to regulate digestive function, control the emotional state. It's number one. Number two, once it's severe chronic, so we should address how your gut system behave afterward. Because prolonged gut issue, you're gonna have to work closely with the gut system itself, not just the mental state.
Yeah. And I think I saw something too on either your Facebook or your Instagram. You were doing like a massage on the stomach.
Yes, this is a traditional. Nobody does this type of integrative abdominal release. This is where I train closely from my mother. So that technique, when I was young, my parents, they treat me, but variety with herbal prescription. My mom would do this, but right 4 years after, actually within the 98, 97, 19, that I was training in acupuncture, I was going through a lot of stomach issue. When I was a child, I had gone through that situational where it never healed. What I did, I keep on asking my mom, how do you do this thing? How eventually it took me about 4 years to master that. I cure my stomach issue, my gut system. I used to go probably maybe once a week to normal, regular, but took me about 4 years to understand that the mechanical movement, how to stimulate those abdominal issues. Yeah, technique down. Different quadrant require different movement.
Yeah.
So this is not. This is inherited from my parent, my mom. Yeah.
So this person also claims that my parents have knee pain, shoulder, and arthritis pain. It's old age pain. Can acupuncture help with that?
So arthritis is a standard. We say I can alleviate the pain, but it's a ongoing. Once you come in, the treatment will help. Within a couple sessions, we should know. For me, it doesn't have to take too long. 2 sessions, you will know whether the acupuncture help or not. From that on, dependent what you need. It could have been every other month you need to tune up, because arthritis is a ongoing condition. So yes, it can be beneficial. Again, needle does not require any medication, so you got nothing to lose there.
Okay, so what I'm getting is that every person has a different frequency.
You got it.
In which they need to come in.
Yes, some people can just come in with a couple sessions, they feel better. Some people probably take 4. So majority of time that I have treated so far, within 2 sessions, we should know exactly what direction, how much it does it help. So.
Yeah. So if it's one of those things where like after 2 sessions they feel great, would you say come in more frequently or less frequently?
So after 2 sessions, I would say let's skip to 2 weeks and see how you do, how your body reacting without having acupuncture within 2 weeks.
Yeah.
But if 2 weeks would be too far out, I would say come in between. I also book the appointment according to the time frame. After the 2 sessions, I usually let's skip a week, see how your body respond to my treatment, and then if that 1 week is too long, I request a call back and schedule. Once your body start to heal, start to improve, I will distance the treatment time. So you can go from once a week to every 2 weeks, every 3 weeks, months, 3 months. Folks who come in once a year or twice a year just to tune up. That's it.
Yeah.
Yeah.
And you're really encouraging people in that way too, just to listen to their bodies and give their bodies what they need. And I feel that's important.
Number one, we don't listen to our body. That's what's happening. We in the business world, scheduling, working with kid, busy schedule. So when the body say there is pain somewhere along the body, could be shoulder, neck, whatever, listen to it. It's a marker, just like a car. Your car tell you why the signal is like suddenly flashing. Oh, there's check engine. We pain, our body go through pain, twitches, all this is a signal that is telling you there's something wrong there.
Yeah.
Step back and listen, and just look at. I'm pretty sure everybody look at the signal of the car as soon as it turn flashing like check engine. You're like, oh, I gotta take this in for service. We don't look at that way until you pass on. Remember, imagine you have pain of just your forearm. If you don't take care of it, eventually you're gonna have carpal tunnel syndrome issue.
Yeah.
You could have a tennis elbow or golf elbow type of condition.
That's the whole thing. If you don't take the time to stop and listen to your body, your body will make you take the time later on.
Yep.
Most inopportune time, but it'll make you listen.
Yeah.
So taking the time to just stop, slow down.
You got it.
Change your oil, so to speak.
You have to. You have to tune up. Yeah.
Can acupuncture do anything for cancer patients?
So I do see a lot of cancer patients. So I'm part of Unite for Her. Unite for Her is a nonprofit organization that supporting cancer patients that going through treatment, chemo, radiation, hormonal drug, immunotherapy, all this thing, because I cannot say I can cure cancer, but we can treat what is the effects of how you feel. When people having cancer, like the emotional aspect, the gut system, all this thing go crazy. I can help minimize the effects of that, stress and anxiety. Yes, I might not be able to cure the cancer, but I can help you enjoy the moment that you have. And along with all those treatment, that's really the side effects of those drugs. Yeah. And that's, it's anywhere, Penn, Jefferson. So all those folks hospital, they have those patients, but they supported by that acupuncture can be beneficial for the side effects of those treatment.
Yeah, because it's not fair to go through treatment and then spend every day miserable and still feeling sick after.
I have seen patients that when they went in for chemo treatment, for 2 or 3 hours, after that, your body going to either changes, heating up or cold, whatever. The way once the treatment started that day, usually the body going up and crashing down. Within 3rd or 4th day, your body almost rock bottom. I found that acupuncture after 3rd or 4th day, that's the time to be treated.
Yeah.
The patient feels better, more energetic, they sleep better. The side effects of it, that's where the super beneficial.
It's got to be so rewarding too, just to be able
that's
to give
one
that
thing
little bit back.
I do see like 35 to 40 of cancer patients at my office
like on a regular
each month.
Basis.
Each month. So these are integrative. Yeah. So I was fortunate to be able to join those group. I was working with the Doylestown Hospital, the Wellness Center with Dr. Angadi, the breast cancer surgeon. So I was in her group. It was for quite some time, and then Unite for Her came in. Mm-hmm. But they're looking. This group only hiring or taking all doctors. So anyone, just general acupuncturist, no. So they look at really high, anyone with a higher degree and understanding the oncology perspective.
Yeah.
So what can I do to detox from chemicals? The chemicals is kind of a broad.
So there is a way you can follow my protocol. There's a simple protocol to detox, but at the same time, acupuncture can help detox your body as well. So definitely coming in, and there's a step for everyone. So.
And then there's another comment here that says, my friend has hormonal issues due to menopause, and it causes her anxiety. Is there any fixes or things that you can do to possibly help that?
Yes. Premenopausal, menopausal is a condition that affecting a lot of women in their late 40 to 50, sometimes can go on until into their 60. Yes, regulate the hormone is number one, is that it will changes the episode of the hot flashes, sleep problem, sweat at night. So it changed from frequency of every hour lasted for 2 minutes or more. Once you get the acupuncture, it's reduced the frequency. It could be one time, maybe 30 seconds, just like headache, migraine headache. I had experience that someone who had almost 3 or 4 times a month severe headache to just a flash, just an aura of it. Same concept with hormone imbalances due to perimenopausal or menopausal area.
And that kind of relief has just got to be priceless.
Yes.
Especially, one of my friends has hot flashes so frequently, so I'm definitely gonna give her your business card.
Yes, it's something that it's a missing link where people didn't understand how acupuncture can balance the hormones itself. It's one of those things we say. There are superhighways that crisscross our body. There are 12 major meridian, 64 collateral, 8 extraordinary. We almost like it's a superhighway plus bridges plus small road that reconnect. When you open and you untangle or fixing those superhighway, your body system flow just like a river. Imagine a river flow endless without any beaver that caused the dam, so it doesn't saturate or flood. Same concept. I look at the body just like a free river that flow through without any blockages. So that's, if I can do that, pretty much everybody be healing.
Yeah, absolutely. And if we can just get everybody just to take the time to dedicate to themselves, because we're in such an age now where it's just always go go go, and you have to do more and you have to do more, and you pretty much keep going until you drop.
Yeah, the idea is you have your limitation on those category, but at the same time we call jotting time log, looking at the time schedule, carefully take your time out, and it's priceless. If we all busy, we can be 7 days, 24 hours a day busy. But the thing is, we also have downtime. Just we don't pay that attention to that. And we just need to jot the time, prioritize the moment that you need to get out, need help. Just go for it.
Just being a little bit more mindful.
When we have children, we know how to fit the schedule in, right? To run them to any sport, any activity perfectly, same way. We don't think about ourselves. So step back and think about ourselves.
So this person asked, we kind of asked this question before, but how do you treat sports injuries in high-performance athletes, and how does recovery differ from general patients?
So sport athlete, usually we say the most important thing is that when the beginning of the training before the actual sport started. So that's the key word. That's where you train your body to get ready. A lot of athletes get injured during that stage. This is where I come in. You come in, I harmonize your body system so it doesn't get locked up, it doesn't get tightness and stiffness. Remember, stiffness and tightness create issue when you do high performance. Usually athletes that on the move already, like in the middle of the season, usually they are well-to-do. They usually don't get hurt that much. At the beginning, that's where you need to come in to be treated. Not only get the mind ready, the physical mean also.
Yeah, like they're stiff in the beginning of the year, like their muscles aren't quite
Yes.
used to moving. Is that what that is?
That's what's happening. So I do have quite a few athletes that come to me, baseball player, runner, um, you name it. So usually I tell them, come in to get that going, get your bodies in sync 1st, and then start your physical strengthening as you go. So,
yeah. So what about
one more thing is that I always say, you have to be ready with your mind.
Yeah.
When you want to train for something, get your mind to be ready. Don't just go at it because you have signed up for a club that you have to go and do it. But your mind and have to be ready. Your mind and heart has to be ready for that purpose. Otherwise, when you go train, you get hurt. When you go play, you get hurt.
Yeah, absolutely.
Yep.
So what about like not just the people who like, you know, they play soccer, baseball, like they're doing that kind of like fast movement. What about bodybuilders or just people who like to go to the gym?
So bodybuilders love to push themselves the way it looks. Even though they have pain, they still push through.
Yeah.
So I always say strengthening. We say have the rep, have the weight adjusted accordingly. If you want to building yourself really quick, you looking for trouble too. But at the same time, we say change the rep, change the weight. Less weight, more rep. Same as more weight and less rep. So start off by strengthening, but less weight, especially. I would say less weight, more rep should be a safety way to do it.
Yeah.
Yeah.
Instead of breaking the rubber band.
And when you're under a lot of stress,
Yeah.
at that moment, I would say that's the day that you don't go and do all the weight because you can break your muscle by pushing it because you under stress you tend to push more. You know what? That's a breaking point. Your body is already tense up. Stress trigger ligament, tendon, and muscle to tense up.
Yeah.
When you go and do exercise, such as weightlifting, whatever, your body don't have that agility. Muscle need to contract. If it's already contracted, we call it weak muscle. If muscle is not contracted, we call strong muscle. When it need to engage and action start to kick in, the energy source kind of explosive like that. So definitely stress and tension go easy with the body.
Yeah.
Yeah.
Because the body will quit.
Yeah, the body will quit. Yes, yes.
It wants
The
time
mind,
off.
the mind doesn't quit, but the body need to be time out.
Absolutely.
So what role does diet play in your treatment, and what types of diet plans are important for recovery and overall health as an individual?
So each and every one that are interested in diet plan, usually folks coming in, they said, yeah, I would like to lose some weight. There's a plan, there's an acupuncture treatment to go along, but along with that, it could be a simple food that I might look at how the food intakes, what type of food that's really trigger the weight or the pain of the gut system, or people said I can't seem to lose weight at all. Then I need to know what's happening with the body system. A good example, one of my recent patient, he was he said for the past 2 or 3 years, he wanted to lose weight. But instead of losing weight, he gained weight. He strictly followed his diet, but still he see his weight going. He just wondered what happened. Came to ask, when I asked him what happened, what are the treatment, he said he's suffering from a lot of body ache and pain, neck, shoulder, hip, knee. He get a cortisone shot frequently, it's almost every 3 months. So keep that in mind. Those shots actually make you gain weight, so you don't lose it. That's why the past 3 years he was not able to, not getting bigger, I said that's where the key word. People take insulins also can kind of increase the weight also.
Yeah.
Somehow a combination of the two, we found out. But after I treated him a couple sessions, he seemed to see some improvement, more agile, moving flawlessly, and less pain. He walked out a couple days ago. He wrote me a really good email. He said, "My knees free of pain." So I was very happy. He was very happy. That's why he sent out that email just to confirm that what I did for him was. And yes, definitely those kind of prednisone, cortisone shot. Be mindful that can be maintaining the weight gainings also. Hey, don't stop. It's you can. If that's what help for pain. Kind of you have to work with it. So.
Yeah. I think the new thing online right now is, or it might not be new, but people are talking about inflammatory foods.
Yes, inflammatory food. Usually, we do talk a lot. People really understand it. Nightshade type of food, vegetable, seem to be affecting a lot of people. So look up nightshade. That's the food that really cause inflammatory issue. But remember, inflammation, not just the gut system. People talk about how mast cell affecting the gut system that influences. To me, from a direction from that perspective, is that mast cell is the body armor of our body. It delivers there when there is inflammation. Usually, it helps neutralizing the histamine, so the pain receptor shut down, so you don't have pain. We say, oh, we want to shut down the mast cell. If you shut down the mast cell, how are we going to survive? We call that body armor of our body, just to neutralize the pain. So first thing we should do is how to improve circulation to release the histamine from binding to the site of pain. Histamine bind to is particular. For instance, if you have a contusion somewhere at the ankle, you will have a lot of pain there. It's swelling happening there. Yes, histamine, it releases to that site. It's a marker to tell us, oh, there is a pain there. So it's a good thing. But at the same time, mast cell will release to that site to help promote healing, clotting factor, desensitize the pain itself. So it's a good thing. But I would look at it, the circulatory system, improve that department will changes not only the pain, it reduce weight, reduce high blood pressure, and all these things go together. We say when you're under stress and tension, your body tense up, right? Now, circulatory system is not moving. It can affect your heart, affect your mind, affect your ligament, tendon, all these things. Freeze the mind, freeze the circulatory system, create that river flow again.
Keep it moving. Keep it moving.
Keep it moving.
It's important.
Yes.
Absolutely.
So people say they have pain. How can you get rid of that pain? The pain is, like I said, the histamine block there, right? When insert the needle, there are needle in the local area close to that pain site, but also there are distal point. These are energetic distal point. It's called acupoint. Acupoint has a given definition of what that acupoint is for. Some acupoint for anesthesia, some acupoint for help promote blood circulation, some acupoint help slow things down. Almost like we say, when they're off balance, we look at the yin and the yang, we look at the 5-element concept. When those yin and yang is not balanced, 5-element theories of the whole body is not balanced, it's having a side effects, meaning either overacting or we say, good example, liver is one of the meridian that we say belong to the wood. Color is green, right? The mother of wood is water. What belongs to water? Kidney and bladder. So if the mother having issue, it will affect the daughter.
Mm-hmm.
Okay, and also the mother of the mother will be affected. The meridian overacting on each other. It's throw off balance. So
So this person comments saying that I've been dealing with limited range of motion and pain in my shoulder, especially when rotating. Can acupuncture help improve the mobility and reduce inflammation in that shoulder joint? And how many sessions would typically be needed to see a result?
so for this person, I will tell you, that's my expertise in when I got my doctor program. So I call this motion style with coin technique for non-specific shoulder issue, including encapsulitis, frozen. That's called losing the range of motion, and that's part of my expertise. So, so far, based on my clinical study, not more than 6 sessions, this person should open up.
That's pretty fast too.
It's called free, frozen, and thaw. So
Uh-huh.
it go through that cycle of treatment. Yes, definitely. As long as you're not one of the 3%. So there are 90% of folks that respond to acupuncture somewhat somehow, based on what I see so far
Yeah.
overall. Yeah, majority of the time, like I said, within a couple of sessions, you should know how much it helped, how much it doesn't help. Some people can walk from there almost immediately 80% better. Some people are like, oh, I don't know. Some bodies, remember, people with circulatory system, after treatment, sometime now your body start to flow. And if it's not circulating as well as those folks who really, really good cardio, they don't have as much pain. But with those with really severe circulation issue, after the treatment, you feel a little bit sore because you activate that. Any stimuli like needle going to a site, now histamine arrived there, mast cell arrived there. So it's all a little bit soreness after the treatment. That's normal. Some people depend on how aggressive the patient want me to work on. There's so many techniques, so many styles. It could be a simple stationary acupuncture point, or release trigger point, or we call stimulate what PT say, or this is dry needling technique, pretty much acupuncture technique as well. So it can be aggressive. We work until the muscle twitch. That can be a little sore, but that person healed really fast within 2 or 3 sessions, 9 days.
Is that one of those things that, like, the more you do it, your body might adjust?
Yes.
Like,
The more you do, people with severe stiff and tightness, at the beginning, you might not feel the needle sensation that much, but when the circulation start to improve, nerves start to reconnect, blood start to flush more. What happened? When that happened, the nerve reconnect. Now, the next time I go put a needle, you feel more sensitive, because now you start to get better. And then you start like, oh, I'm kind of scared now. But no, it's not that. It's just you feel better. You need more or less of me. So more free time, less of me to come for treatment. So that means that person is improving.
yeah, and you're kind of just kickstarting the
Yeah.
body and
Just a
doing
good-
the healing.
Yeah, good example, neuropathy. Usually neuropathy become numbness, right? With acupuncture treatment, at the beginning you don't feel it. But once or twice session, the person is complaining of feel like a burning sensation and then painful. That's how it is. Neuropathy means nerve damage. There's no nerve connection. Acupuncture, what it does, almost like open super highway where the nerve to reconnect again. When nerves start to reconnect, you know what happened? You start to feel that initial like burning, and then painful, and then gone.
Yeah.
That's how I always ask people to remember. That's how it's healing that
Yeah.
way.
there are steps to get through it.
Sometimes I say there's no pain, no gain. Same concept of weightlifting as well.
Yeah. No rainbow without the rain.
You got it. So, but yeah, the beauty of it that you walk out, you enjoy the moment.
Yeah.
That's pain-free or feeling really good, create willpowers also. Acupuncture, almost people coming in, they say, I don't know what I need, but I just want to have some global balance or something. Global balance means harmonize the mind, the body, the gut system, the sleeping, all this kind of together. You walk out from there, I always say those who get, almost, I don't want to be quote, but one acupuncture almost like 5 to 10 massage.
Mm-hmm.
It's just one acupuncture treatment. Remember, acupuncture calm the mind and then relaxes the body.
Yeah.
Massage calm, relaxes the body and then calm the mind. It can last you about an hour to 3 hours, or to a day or two. Then your body stiffen up again.
Yeah.
So I always, but don't get me wrong, massage also a combination of beneficial. If they get massage first, come for chiropractic adjustment, or get acupuncture first, go for chiropractic adjustment or exercise. Because remember, you loosen up the muscle first, and then the bone structure can realign again. Almost like a combination, physical therapy, chiropractic, massage, acupuncture, anything. Like these are active sport athletes need to do this to enhance the super function of the body.
Yeah. It's kind of like they tag team.
Yes, they go together. Yep.
So it says here that I saw that you've worked with the Philadelphia Flyers, which is incredible, and I'd love to hear more about what that experience was like.
So initially, because my wife actually, she was within a group of a conference with Dr. Angadi and her group. There's a PT guy from the Philadelphia Flyer happened to be there, and he mentioned that they were looking for an acupuncturist because one other gentleman left there in 2010. So initially, for me, I focus on a general public. Doesn't matter whether a sport team or someone that I run into on the street. I look at that person as a person too. It doesn't stimulate me as a and get so excited. This team, but I get nervous anyway. I say, you know what? Maybe they just randomly asked, so I didn't respond for almost like 6 months. And suddenly one day, he called again, like, "Hey, we've been waiting for you. When can?" I said, "Well, let me think about it." And suddenly, one of the Jim Carson, basically, he sent Diacona to call me. He came to my office in Southampton. He interviewed me on a Friday afternoon. Within half hour, I told him how I integrate my scientific acupuncture, my parent technique.
Yeah.
So halfway, I think within half hour, he called me. He parked on the side. He said, "Hey, you are hired. You have to come in on Monday. So there are folks will be waiting for you there." So that was it. I never went in for interview, but all that. Yeah, I was excited. Was there, kind of nervous at the same time, but it was an honor that I was able to join and were asked nicely to join. And I was able to see many of the athletes from 2010 on until 2020, around 2021. I still do see some of the athletes that live around there too. So these are the folks that if they need touch up, because I've been building that relationship. So it's an outside. If they need more, they usually reach out to me.
That's exciting though. Like that's got to be like a badge of honor almost for you.
Yes, it's a good feeling to be able to go out there and showcase acupuncture as a technique that can be beneficial for this guy. Usually, they get injured. I'm there with a combination of their therapies with acupuncture, seem to put them back on ice again.
Yeah.
So that's where the fun part. Like you see those guys back to play again. So.
And it's almost like it normalizes like the aspect of holistic medicine and acupuncture.
Yeah.
To see, like, I mean, people idolize
Yes.
their sports team and their favorite players, and knowing that that's something that they've done and works for them almost makes it seem like it's a more normal,
Yes.
quote unquote.
Actually, they've been using that for quite some time before the general public. The acupuncture been out there with the sport team for quite some time, especially in Canada. They use it for quite some time before it's spread it up to the state. But yes, people are actually using it, but just we don't hear from it.
Yeah.
And these are super performing athletes. They integrate this that this is holistic health into. People call this a integrative medicine. It's been existing for thousands of years. I call if it's integrative, it should not be that. It's been proven that it's effective.
Yeah.
So we say if it's not effective, it would have been dissolved within 1 week, 2 weeks, or 2 years, 3 years. We see people come up with a lot of plan, a lot of technique, but it's come up and disappear. But acupuncture and Oriental medicine is still going. So that means it has been proven that it is effective. But the thing is, you have to find the right people that are into this. You know, you don't just look at it, hey, that is an acupuncturist. You study about that acupuncturist, study about that Oriental medicine doctor, what their backgrounds, and all this kind of thing. May suit, sometimes you need that connection. Not every patient connected with the therapist or doctor or practitioner. You have to fine tune that direction too.
Yeah,
So,
and that's with everything too.
Yeah.
I mean, your hairstylist, your tattoo artist, your primary care physician.
Yeah.
Like making sure that it's people that you trust, I feel like really does go a long way. And it's really the connection or being able to trust the person who's taking care of your body.
Yes.
I feel like is a really big deal. So just knowing that you have that nice, welcoming environment, like you listen to people makes a really big difference.
Yes, it does. I've seen that. I to bring patient in, you have to care at the same time listening to what they need, what they're concerned. I've been successful because, you know, each and every one that come in to see me, I look at them just like my family. I'll treat them just like my family. So that's it. I want them to be sure that they spend their time there, spend their money coming to see me, whether it doesn't matter. It's more like my responsibility to help those person is that if I try my best to the fullest and if it doesn't change, I'm happy because I go to sleep happily. But if I do a half type of works, half so-and-so, then it's my fault because I'm not doing the job for those patients. So my job is to take care of everyone the same way as I take care of my family.
Yeah. I mean, it's also a matter of like personal integrity and knowing that, I mean, from even just when you were growing up, when you were just a kid, like it's something that this earth has kind of called you to do, is just to take care of people and heal them. And you've learned every step of the way, it seems like, and that's just so impressive too, just to know how extensive of a background that you have.
So it's somehow it's unfold that way. So I always intrigued of wanting to help people in that direction. Is that to put everything together and take it from there. I never stop learning. So if any patient coming in, if I have difficulty, I will find out whether that person, even in my sleep, I would think about the sleeping portion. So.
other things happening.
So, all the questions that need to be addressed?
Yeah, all the questions that are going to be sent throughout the chat are going to be on that tablet right there, and you guys can ask them away.
Okay.
So, looks like somebody wants to know what kind of treatments or rehab work did you focus on?
So, treatment and rehab, dependent of how, what condition of rehab that you are going through. For instance, if someone had a knee replacement, right? That definitely, at the beginning, probably 4 to 6 weeks. 4 to 6 weeks of after the after the replacement, then I can assess from there how much range it can change. All this dependent to the condition of the people that are suffering from. So.
I mean, yeah, and you just kind of
yeah, you have to come in and get it
that's in front of you is really
yeah.
the biggest thing.
Yeah,
absolutely.
I work with anyone with the rehab, so understand what's going on, either going through PT or going through acupuncture. Sometimes like combinational is like I said, it's the best thing to do.
Yeah.
So take a break on certain thing, but learn how the body respond to that rehab process.
Yeah, and they also said, how did that opportunity come about?
With
working on the rehab. And I think that kind of just goes back to
your working opportunity comes usually like this. Some patients, they go and see a chiro. Mm-hmm. Some patients go to see a doctor and orthopedic. Majority of orthopedic or chiro, I do have patients that go in and out. So all those doctors, somehow, they connected to me. Sometimes I don't know them. But that's how the connection is between all those medical doctor and chiropractor that really work close. And somehow, like I said, they know me that I don't know them.
Yeah.
They know me through their patient. So some patient would grab my business card and put somewhere. So majority of my patients are word of mouth. Basically, if I see a son, eventually I'll see the whole family, mom and dad, children, so like that. So it's a rapid fire of how I engage and take care of those patients. Yeah, definitely how it come about. Definitely someone that know me that I don't know them.
Yeah. Well, you've got the name, you know.
Thank you.
And I do think that might just be just about all the time that we might have for tonight. But
all right.
I do want to thank you so much for joining us and just telling us all about, you. You're amazing, Dr. Danny.
Thank you so much. Thank you for the opportunity. I hope everyone enjoyed this first segment of my podcast. And hopefully, if there is something that I said incorrectly, I apologize for all those things. And I hope it's not disturbing people.
No, you did absolutely wonderful. Thank you for joining us for our first What's Up Wednesday.
Thank you.
With the